Hello everybody, today we are going to talk about another coronary anomaly that you might come across, and that is the anomalous takeoff of the left circumflex coronary artery. By far, when it comes to the origin of the coronary arteries, the most common one is the separate ostia for the LAD and the left circumflex coming off from the left cusp without any left main. It makes it a little difficult to engage those arteries, but those are usually very benign. But the one that we're going to be talking about today, which is the one shown on the picture on the left, is the anomalous take of the left circumflex coronary artery. Here in this cine loop on the left, as you can see in picture A, it is coming off from the right coronary artery, but it can also come off from the right cusp with a separate ostium. Nevertheless, one way or the other, this left circumflex coronary artery then has to take a different anatomical course to supply the lateral portion of the left ventricle. And we will come to that, how and why is this important. So first we come on to the incidence of this anomaly. By far, as I said, it's the second most common anomaly, but the incidence is very low, less than 1%. Some literature say about 0.5%, but nevertheless, once in a while you will come across a patient that will have an anomalous takeoff of the coronary artery, and you will be seeing the one that is more common, which is either the left main, which was absent, with and left anterior descending a left circumflex coronary artery arising from the left cusp with a separate ostia, or the left circumflex coming off from the right cusp. Here in this picture A, as you can see, I have shown the left circumflex in the yellow color and the right coronary artery is in the red. The right coronary artery will usually have the normal course. It's only the left circumflex which will have to take a different anatomical course to supply the area of the myocardium. On the picture in the left, you can see that the filling of the left circumflex is sluggish. This is because the catheter is selectively engaged into the right coronary artery. Most of the time, if that left circumflex is coming off from the right coronary artery, as in this case, the takeoff will be a little different, maybe more vertical as in this case, so it becomes a little more challenging to selectively engage the left circumflex, just because you might have to try different catheters and might get lucky to selectively engage that anomalous left circumflex, but by far we don't know, and we don't have any catheters that will selectively engage this anomalous takeoff of the left circumflex. With that, we come to the picture B here, and this is what I was talking about, is why is it important to know about this anomaly, or the anomalous takeoff of the left circumflex coronary artery. And this is in very few patients. They might come in with some symptoms. It is important to note that for the most part it's a benign finding, incidental finding during coronary angiogram, but once in a while you might see patients who might have some symptoms. Maybe it can be chest pain, it can be arrhythmias, and rarely sudden death or collapse of the patient, and then the patient gets an angiogram, and then you are trying to figure out if that anomalous takeoff of the left circumflex is the culprit for any of these presentation. But for the most part it might not be. The patient might have separate problem for that, and then the takeoff of the left circumflex might be an incidental finding. I want you to pay attention here on the blue. This is your pulmonary artery, and then in the red I have shown the aortic cusp. you can see that the right coronary artery arising from the right cusp and then going on supplying the right ventricle. This is the tricuspid valve here. In some patients, this left circumflex have to take, as we talked about, a different anatomical course, so it might go in between the pulmonary artery and the aorta. So what we call like a course of the left circumflex, anomalous course of the left circumflex through the great arteries, mainly the pulmonary artery and the aorta. And this becomes even more important if the patient has symptoms that correlate with when they are in hypertensive crisis, or if the patient is exercising where the PA pressures or the aortic pressure might go up, and if this artery is going in between these great arteries in a slit-like space, it might get compressed. Sometimes you might see a patient who might not have symptoms, but when they do a stress test, you might see ischemia in the left circumflex coronary artery territory, just because when they exercise, their blood pressure goes up and it can press the coronary artery. The angiogram, unfortunately, in this case, will not be helpful. It might tell you that there is anomalous takeoff of the left circumflex, but it might not tell you the course or the path that the left circumflex coronary artery is taking. And in these cases, then you will have to do a CT angio, what we call like a cardiac gated CT angio with contrast. And that will tell you if that left circumflex is going in front of the aorta, behind the pulmonary artery, or in between the pulmonary arteries, and if it is significantly leading to the patient's symptoms. But again, as I said, it becomes very difficult, very challenging when you have patients coming in with these symptoms and you find an incidental finding of this anomalous left circumflex, which may or may not be the culprit for their symptoms. And if you find that and you have used all the resources and not able to find any other reason for the patient's symptoms, then sometimes you might ask your CT surgery colleagues for these patients to have the bypass if this left circumflex is truly going in between the great arteries leading to the patient's symptoms. So I hope this was helpful. This was a very short talk on one of the common anomaly that we come across. In the next talk, we'll talk about another coronary angiogram video. Have a good day. Thank you.